Hello everyone, this is Dr. Dev. I'm a Chief Medical Oncologist, Medicover Hospital, Vizag. So today we are going to talk about lung cancer. This is the most commonly diagnosed cancer all over the world and its incidence is increasing in India. It used to be more common in men because of smoking habits, but nowadays the lung cancer incidences are increasing even in women because of change in habits or lifestyles. So as I said earlier, the most important risk factor for lung cancer is smoking, either BD, cigarette or other forms of tobacco, and also consumption of tobacco in any forms like gutka. All this contribute to increased incidence of lung cancers. So apart from smoking, we do have other factors like exposure to pollution, then exposure to radiation, then exposure to alcohol consumption. So all these factors contribute to increased incidence of lung cancer. So patient who has lung cancer, they usually present with cough. They could have a hemoptysis. So sometimes when they cough, the blood could come in the cough. And apart from that, depending if the cancer is at an early stage, they could spread to the bones and they could present with the bony pains, like pain in the bones. And they could also have, sometimes very rarely, if the cancer spreads to the brain, they could have a seizures or fits, or they could have loss of sensorium. So this is depending upon the size. Apart from that, the general cancer features like loss of appetite, loss of weight could be part of any cancers. So if anybody is smoker, if anybody has these kind of symptoms, they should visit to the hospital immediately. So when they come to the hospital, then we would like to do an imaging modality like X-ray, CT, and if you diagnose there is some abnormal white shadows, so like suggestive of lung cancer, then we would go ahead and do a biopsy, and that would confirm lung cancer. There are different types of histologies. It could be non-small cell, which is adeno or squamous, or it could be small cell. And in this, we would like to do a further testing in the biopsy. We would do a molecular testing which comprises of EGFR, KRAS, or ROS, or ALK status, or PD-L1 status. So all this molecular testing would help us to determine which kind of therapy we need to give, and so. If lung cancer is at an early stage, stage 1 and all, then we would go ahead for surgery depending upon the patient's fitness. And if it is somewhere around stage 2 or 3, we would go ahead with the CTRT, that is combining chemotherapy with radiotherapy. And if the patient achieves a good response, then we would consolidate with the immunotherapy. If it is stage 4, earlier stage 4 lung cancer used to be like death sentence, not much outcomes, but these days, even at stage 4 lung cancer, we have a very good quality of life with a median survival somewhere around 3 to 4 years. All credit goes to the molecular targeted therapies which has been come into picture over the last 1 to 2 decades. Nowadays, because we have a targeted therapies like against EGFR, ALK, ROS, and also MET inhibitors, we have a immunotherapy which has come into lung cancer and has changed the treatment landscape of lung cancer completely. So nowadays we give chemotherapy along with immunotherapy in the first line in the stage 4 lung cancer who doesn't have mutations, and the quality of life is good, and the duration of life or duration of response, everything is much better with this combination. So this is all about lung cancer in brief. If anybody wants to know more about lung cancer, please they could visit us, and we would like to do a few screening tests as well, and we could have if anybody has these symptoms, you could detect at an early stage and have a good quality of life. Thank you.